We turn our attention now to a surgical balancing act. For one California woman, getting the nose of her dreams also meant changing her chin, because when it comes to facial features, it is all about harmony, symmetry, and a sense of proportion.
I've always had insecurities about my face. Throughout my whole childhood, honestly, I've never liked how my nose looked.
31-year-old Elvia Garcia's preoccupation with her nose led her to Beverly Hills board-certified plastic surgeon Dr. Rady Rahban. Elvia says she really didn't pay much attention to her chin until she consulted with the doctor and told him,
"Oh, I want a small, cute nose." And then he was like, "Okay, but we have to do something that fits your face." And that's when he told me that I didn't really have a chin, and a chin would add more structure to my face.
Dr. Rahban says while he never attempts to sell a patient on an idea,
I educate them. I never tell them they have to do it. I never tell them it's necessary. I tell them, hey, perhaps you should consider your nose and chin are married. And many times, one of the contributing factors to having a large nose is having a weak chin. The chin implant is pretty straightforward. It's going to just give you a little bit of projection to your jaw. Make this portion a little bit stronger because right now it's a little bit weak.
So Elvia, who works in real estate and never liked the way she looked in photos, decided on both a rhinoplasty and a chin augmentation.
I just feel like now that I'm gonna have this surgery, I'm definitely gonna feel more confident being in the pictures, selling houses, being in the office more often, just being out there more.
You ready?
I am ready. I'm a little nervous.
Everybody's nervous. It's surgery.
As part of the rhinoplasty, Elvia also asked the doctor to improve the appearance of her nostrils.
Sometimes the nostril flares. And so we actually remove a little bit from the corners. It's called an alar base reduction, and that really is quite powerful. It narrows the nostrils, making them a little more in. I start the surgery always with the nose. We lift up the skin of the nose, we rearrange the bone, we make the cartilage in a better shape. There is a small degree of reduction from the septum, and that helps with, oh, my breathing is even better. And then after I'm done with the rhinoplasty, I turn my attention to the jaw and the chin area. I do one of my favorite procedures, which is a chin augmentation or chin enhancement. That combination of a more balanced nose with a more prominent or defined chin and a little less fat tends to create a really beautiful ensemble.
And how does Elvia feel she looks now?
Honestly, I'm very, very happy, very excited. I'm very confident. I love it.
That aspect right there is the end-all be-all. There's no substitute for self-confidence.
With added structure and more balance to her face, Elvia says she loves taking and being in photos once again, and her renewed self-esteem has even led her to a new real estate company.
I'm really happy and I'm ready to sell some houses.
This is the reason why we do it.
I love it, everybody loves it, so I mean, it's good.
Pleasure.
Thank you.
Elvia says she is thrilled to now be able to put her best face forward. Now, for more on this and other types of plastic surgery, just check out Dr. Rahban's website at radyrahban.com.